Hi guys, we welcome you back to our channel. Today we'll be discussing a class 2 composite restoration, how it is done, what are the various methods. So I'm Dr. Puneet, I'm a practicing microendodontist from Chandigarh. So this is our case. This is a maxillary right first premolar. You can see that there is a distal caries on it. So we'll start with excavating the lesion first. We use a round bar. Under water cooling, we are excavating the carious lesion. The good thing was the patient had no complaint. It was a accidental routine finding during the examination and radiographic session. So we told the patient that the tooth needed a restorative treatment and scheduled the appointment. Under local anesthetic, we are excavating the carious lesion. We'll apply rubber dam after seeing the extent of the lesion. Sometimes these lesions extend beneath the gingival margins. In those cases, we prefer seeing the floor of the class 2 cavity and if needed performing the gingivectomy before placing the rubber dam. The most important thing in class 2 which we never do is breaking the contacts. We always break the contacts so that the composite and the tooth interface on the proximal sides comes to the cleansable areas. So after clearing all the cavity, we've applied the rubber dam. Now the rubber dam is well inverted and the margins of the dam are beneath or below the gingival seat. We're using dentsply matrices and dentsply ring as a separating agent to compensate for the thickness of the matrix. So we are etching the tooth. We leave it for a few seconds, wash it, and now applying the bonding agent. The beauty of the rubber dam is that we can clearly focus on the work in hand and there's no interference from the patient. So after applying the bonding agent, we cure the bonding agent. Now the first thing that we do is sealing the gingival seat area. I prefer using a long file, a 10 number file to seal the area between the clamp and the gingival seat. Here the first thing that we'll do is we'll build the proximal wall first. So we are pushing the composite against the matrix band. The band has been already burnished with the adjacent tooth so that we get a good contact, and the separating ring also helps us in achieving the same. So we are just sculpting the composite and making the proximal wall, that is we're converting the class 2 into a class 1 restoration. So we keep on doing that. Now what we'll be doing is we'll be slowly condensing the layers of composites in the floor of the cavity, and then we'll be making cusps so that our restoration looks normal as well as it's functional in nature. The micro brushes help us to adapt the composite in a nice way against the previous increments. So here we're building the buccal cusp where we'll use a micro brush to blend this composite. The more finishing we do with fine instruments, the lesser hard work we have to do towards the end of the restoration. So here our buccal wall is almost complete. Now we'll make the palatal cusp. This increment will be used to make the palatal cusp. Once we are done with the palatal cusp, we will be making the marginal ridges. And after the marginal ridges, we'll just be giving some finishing touches. So now we are almost done with the palatal cusp. You can see already the anatomy is almost fine. I am using a micro brush to blend the composite with the existing tooth structure. So now the last increment is to make the marginal ridge. The most important thing is the level of the marginal ridges on the adjacent teeth should be equal so that the forces do not separate the teeth and food impaction is not there. So here we are using some tints to these are just they just add to the look of your restoration. They do not have any functional role, but
you should start trying
them to achieve those natural, beautiful anatomies. Finally, they are cured under a layer of glycerine to prevent the atmospheric oxygen from inhibiting the polymerization of the composite. This is the most important step. We use a 12 number blade to clean off the flash or the excess composites in the gingival areas. A new blade is to be used every time, and this helps you in finishing your composites. The excess is being removed. Now I'll be using some finishing discs by 3M to finish the excess contours and to give the proper contours. After the discs, we'll be using some polishing buffs from 3M to complete our restoration. These are the polishing buffs we are using to give the final gloss to our restoration. So our restoration is almost finished, and you can see a well neat and clean plaster restoration with tight contacts complete. Will be and now this is the pictures after removing the rubber dam. So now this is where we started, and this is where we could finish. Thank you so much for your time.